Tonight, local doctors are feeling big relief in this fight against COVID-19 because we've just learned members of the Navy assigned to help over at IU Health are now moving out. The 20-person team was brought in last month to help out with the surge. As Lauren Kostick tells us tonight, that team is leaving because COVID cases are now dropping.
After a months-long surge in cases, hospitals are finally feeling some relief.
Our cases are coming down. They're coming down significantly in the community too, due to the Omicron variant.
At its peak in January, IU Health was treating more than 600 COVID patients across its hospitals. As of Tuesday morning, that number was down to 256. Because of this, the U.S. Navy team is ending its stay at Methodist Hospital after a 60-day deployment.
That really helped not only our patients, but also helped support our staff getting through one of the more difficult COVID surges that we've had.
Despite this drop in cases, IU Health officials remain cautiously optimistic.
So we are not oversurged from where we have been in January, but still extremely busy.
At the same time, hospitals are dealing with burnout and exhaustion.
I think some relief that things look a little bit better. At the same time, a lot of fatigue.
With this window of relief, IU Health is also trying to catch up on elective surgeries, many that were postponed during the latest surge.
We have brought back a few surgeries. We're not at full capacity on that yet, but we're working our way towards that.
As the virus continues to stick around, health officials are now looking towards the future.
And realizing that COVID is probably going to be here like other respiratory viruses are, like influenza and some of the other viruses that we see. But I think that's where most of us are, is that we're figuring out how we live with it.
And also how to manage it within the hospitals.
Let me give you a closer look at the COVID numbers across Indiana, and overall it is really good news. Check this out. Here is the peak that we had back here in mid-January. That's when we saw that spike in Omicron cases. Now look what's happened. COVID cases have gone down, 92% decline. The average number of daily cases, again, down 92%, which is a staggering decline. In fact, that is the lowest number that we've seen since early August. But cases are just one of the metrics we've been watching since this pandemic began. Hospitalizations are also down. Tonight, the number of Hoosiers in the hospital with COVID has gone down 69% since January 13th. We also talk a lot about positivity rate here in Indiana, and look at this. That number is down 71% since January 19th. Remember, the goal for the positivity rate is to be below 5%. It was really high during the most recent surge, but that number's going in the right direction, which is good news. Now we're at nearly 9%. We'd certainly like to see all these numbers continue to go down. The very last thing any of us want to see is another variant that comes along and sends those numbers soaring again.
As cases are dropping, doctors still stress to get your COVID-19 vaccine. Now they're warning a fourth shot could be in your future. Countries like Israel and Sweden are already offering a fourth dose, but it's only for older adults. U.S. health leaders say another dose could be ready to give this fall. The CDC says they have yet to recommend a fourth dose for the general public, but they updated their guidelines. It says it's a good idea for some who have weakened immune systems.
Many of us expect that in the years to come, we will have yearly doses of COVID vaccine, the same way that we do for the flu vaccine.
The big focus for health leaders is to get more shots in arms of U.S. adults. Right now, 65% of Americans are vaccinated. To get more information on case numbers and the COVID shot, head over to WTHR.com/coronavirus.